Before understanding how multiple myeloma affects the kidney, let us first see how kidney normally functions. The kidneys are vital organs that filter the blood to remove waste materials from the body. The kidney has many filters which acts like sieve, which we call glomeruli. The blood passes through the glomeruli and then enters the tubules which act like pipes. Through these pipes, the filtered blood ultimately becomes urine and exits the body as waste. As now we have seen how kidneys normally function, let us see how multiple myeloma affects the kidney. Multiple myeloma is a type of blood cancer that affects the plasma cells. Plasma cells are immune cells that normally make special proteins called antibodies to fight off the diseases. These antibodies are part of body's defense system to neutralize the infections that invade the bloodstream. Patients who have multiple myeloma make plasma cells that are abnormal. When this happens, the levels of these proteins in the blood become higher than normal. The abnormal proteins that are made by the plasma cells in patients with multiple myeloma float around in the bloodstream. The blood passes through the filters in the kidney, and these abnormal proteins enter the tubules. These abnormal proteins then travel through the tubules and can join up with another type of protein normally present in urine, pan-horse protein. If these two proteins join together, they become too big to pass on through the tubules and therefore cannot exit the kidney in the form of urine. This combination of proteins result in large casts that block the tubules inside the kidney. These tubules are just like the pipes that carry water. When they get blocked, fluid cannot flow through. These blockages lead to kidney damage. So, do all people with myeloma develop kidney-related complications? Well, only 30 to 50% of the patients suffering from multiple myeloma develop myeloma kidney. That is, kidney-related complications occurring in multiple myeloma. There are things that will make a patient with multiple myeloma more at risk to develop myeloma kidney, such as dehydration, that is, drinking less water, smoking, taking medicines such as painkillers, and high calcium level in blood. All these things lead to increased formation of the cast, which affects the kidney. So, when can a patient suspect if he has developed a myeloma kidney or not? The symptoms of multiple myeloma are typically fatigue, bone pain, and infection. This is all because multiple myeloma causes anemia, destruction of the bones, and decreased production of normal antibodies that fight the infection. Myeloma kidney, when in the initial stages, does not usually show any symptoms. However, people who have developed advanced kidney disease will have symptoms related to kidney failure, including itching, confusion, nausea, and fatigue. So how to diagnose whether a person has myeloma kidney or not? In order to diagnose myeloma kidney, a biopsy needs to be done. In kidney biopsy, a small piece of kidney is taken and is looked under the microscope. Other tests include urine and blood tests. Abnormal proteins in blood and urine can be detected. High level of creatinine in blood will show advancement of myeloma kidney. So after we have made a diagnosis of myeloma kidney, how to actually treat it? The aim to treat myeloma kidney is actually to treat myeloma, which can be done with the help of chemotherapy, bone marrow transplant, and dialysis. The supportive treatment include drinking adequate waters, that is 2 to 3 liters per day, avoiding taking painkillers, and treatment of high blood calcium levels. So this is all about myeloma kidney in brief.